Depression is a real medical condition. Depression is a common but serious mood disorder. Depression symptoms can interfere with your ability to work, sleep, study, eat, and enjoy your life. Although researchers are still studying the causes of depression, current research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Most people with depression need treatment to feel better. You can't just forget about depression. Well-meaning friends or family members may try to tell someone with depression to snap out of it, just be positive, or you can be happier if you just try harder. But depression is not a sign of a person's weakness or a character flaw. The truth is that most people who experience depression need treatment to get better. If you are a friend or family member of a woman with depression, you can offer emotional support, understanding, patience, and encouragement. But never dismiss her feelings. Encourage her to talk to her healthcare provider and remind her that with time and treatment, she can feel better. Most people with depression need treatment to feel better. If you think you may have depression, start by making an appointment to see your healthcare provider. This could be your primary doctor or a health provider who specializes in diagnosing and treating mental health conditions, for example, a psychologist or psychiatrist. Certain medications and some medical conditions, such as viruses or a typhoid disorder, can cause the same symptoms as depression. A healthcare provider can rule out these possibilities by doing a physical exam, interview, and lab tests. Your healthcare provider will examine you and talk to you about treatment options and next steps. 2. Depression can hurt, literally. Sadness is only a small part of depression. Some people with depression do not feel sadness at all. A person with depression also may experience many physical symptoms, such as aches or pains, headaches, cramps, or digestive problems. Someone with depression also may have trouble sleeping, waking up in the morning, and feeling tired. If you have been experiencing any of the following signs and symptoms for at least 2 weeks, you may be suffering from depression. Persistent, sad, anxious, or empty mood. Feelings of hopelessness or pessimism. Irritability. Feelings of guilt, worthlessness, or helplessness. Decreased energy or fatigue. Difficulty sleeping, early morning awakening, or oversleeping. Loss of interest or pleasure in hobbies and activities. Moving or talking more slowly. Feeling restless or having trouble sitting still. Difficulty concentrating, remembering, or making decisions. Changes in appetite or weight. Thoughts of death or suicide attempts. Aches or pains, headaches, cramps, or digestive problems without a clear physical cause that do not ease even with treatment. Talk to your healthcare provider about these symptoms. Be honest, clear, and concise. Your provider needs to know how you feel. Your healthcare provider may ask when your symptoms started, what time of day they happen, how long they last, how often they occur, if they seem to be getting worse or better, and if they keep you from going out or doing your usual activities. It may help to take the time to make some notes about your symptoms before you visit your provider. 3. Certain types of depression are unique to women. Pregnancy, the postpartum period, perimenopause, and the menstrual cycle are all associated with dramatic physical and hormonal changes. Certain types of depression can occur at different stages of a woman's life. Premenstrual dysphoric disorder, PMDD. Premenstrual syndrome, or PMS, refers to moodiness and irritability in the weeks before menstruation. It is quite common and the symptoms are usually mild. But there is a less common, more severe form of PMS called premenstrual dysphoric disorder, PMDD. PMDD is a serious condition with disabling symptoms such as irritability, anger, depressed mood, sadness, suicidal thoughts, appetite changes, bloating, breast tenderness, and joint or muscle pain. Perinatal depression. Being pregnant isn't easy. Pregnant women commonly deal with morning sickness, weight gain, and mood swings. Caring for a newborn is challenging too. Many new mums experience the baby blues, a term used to describe mild mood changes and feelings of worry, unhappiness, and exhaustion that many women sometimes experience in the first 2 weeks after having a baby. These feelings usually last a week or two and then go away as a new mum adjusts to having a newborn. Perinatal depression is a mood disorder that can affect women during pregnancy and after childbirth and is much more serious than the baby blues. The word perinatal refers to the time before and after the birth of a child. Perinatal depression includes depression that begins during pregnancy, called prenatal depression, and depression that begins after the baby is born, called postpartum depression. Mothers with perinatal depression experience feelings of extreme sadness, anxiety, and fatigue that may make it difficult for them to carry out daily tasks, including caring for themselves, their new child, or others. If you think you have perinatal depression, you should talk to your healthcare provider or trained mental health care professional. If you see any signs of depression in a loved one during her pregnancy or after the child is born, encourage her to see a healthcare provider or visit a clinic. Perimenopausal depression. Perimenopause, the transition into menopause, is a normal phase in a woman's life that can sometimes be challenging. If you're going through perimenopause, you might be experiencing abnormal periods, problems sleeping, mood swings, and hot flashes. Although these symptoms are common, feeling depressed is not. If you are struggling with irritability, anxiety, sadness, or loss of enjoyment at the time of the menopause transition, you may be experiencing perimenopausal depression. Depression affects each woman differently. Not every woman who is depressed experiences every symptom. Some women experience only a few symptoms, others have many. The severity and frequency of symptoms and how long they last will vary depending on the individual and the severity of the illness. 4. Depression can be treated. Even the most severe cases of depression can be treated. Depression is commonly treated with medication, psychotherapy, also called talk therapy, or a combination of the two. Antidepressants are medications commonly used to treat depression. People respond differently to antidepressants, and you may need to try different medicines to find the one that works best. Researchers also are studying and developing other medications for depression, such as brexanolone for postpartum depression and esketamine. There are many different types of psychotherapy, such as cognitive behavioral therapy or interpersonal therapy. The particular approach a therapist uses depends on the condition being treated and the training and experience of the therapist. Therapists also may combine and adapt elements of different approaches. Depression affects each individual differently. There is no one-size-fits-all for treatment. It may take some trial and error to find the treatment that works best. You can learn more about the different types of depression treatment, including psychotherapy. What to consider when looking for a therapist. Therapists and patients work together, and finding a good match is important. The following tips can help you find the right therapist. Ask about their areas of expertise. Therapists have different professional backgrounds and specialities. You want to find a therapist who has experience working with your specific condition. Find out what kinds of treatments they use. Ask if those treatments are effective for dealing with your particular mental health problem or issue. Find out how you'll evaluate progress. Determine how long treatment is expected to last and when you should expect to gain relief from symptoms and improve your quality of life. Don't be afraid to keep looking. Rapport and trust are essential. Discussions in therapy are deeply personal, and it's important that you feel comfortable with the therapist you pick. 5. Researchers at the National Institute of Mental Health, NIMH, and across the country are dedicated to women's mental health research. Researchers continue to study depression to improve the way this medical condition is diagnosed and treated. For example, NIMH researchers are currently working to understand how and why changes in reproductive hormones trigger mood disorders, including postpartum depression, premenstrual dysphoric disorder, and perimenopausal depression. NIMH scientists are conducting a large number of research studies with patients and healthy volunteers to better understand why some women are at higher risk than others, and how they can translate these findings into new treatments or new uses of existing treatments. You can play a role in research by joining a clinical trial. Clinical trials are research studies that look at new ways to prevent, detect, or treat diseases and conditions. The goal of clinical trials is to determine if a new test or treatment works and is safe. Although individuals may benefit from being part of a clinical trial, participants should be aware that the primary purpose of a clinical trial is to gain new scientific knowledge so that others may be better helped in the future. In addition to volunteer research opportunities for the patient groups listed above, research opportunities for healthy volunteers are also available. Healthy volunteers play a critical role in our studies. Depression, major depressive disorder or clinical depression, is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think and handle daily activities, such as sleeping, eating or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Not everyone who is depressed experiences every symptom. Some people experience only a few symptoms, while others may experience many. Several persistent symptoms in addition to low mood are required for a diagnosis of major depression, but people with only a few but distressing symptoms may benefit from treatment of their subsyndromal depression. The severity and frequency of symptoms and how long they last will vary, depending on the individual and his or her particular illness. Symptoms may also vary depending on the stage of the illness. If you have been experiencing some of the following signs and symptoms most of the day, nearly every day, for at least 2 weeks, you may be suffering from depression. Persistent sad, anxious or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering or making decisions. Allow your hands to rest comfortably in your lap. Gently close your eyes, settling into awareness of the body and the breath, feeling into our body right now, noticing what's here, open to whatever is to be experienced in the body in this moment. Connecting to the breath, noticing the wave-like movements of the belly. In this practice, we'll be cultivating loving kindness. We all have within us this natural capacity for loving kindness, or friendship that is unconditional and open, gentle, supportive. Loving kindness is a natural opening of a compassionate heart to ourselves and to others. It's a wish that everyone be happy. We begin with developing loving kindness toward ourselves, allowing our hearts to open with tenderness. Now allow yourself to remember and open up to your basic goodness. You might remember times you have been kind or generous. You might recall your natural desire to be happy and not to suffer. If acknowledging your own goodness is difficult, look at yourself through the eyes of someone who loves you. What does that person love about you? Or you may recall the unconditional love you felt from a beloved pet. It may help to use the imagination and to picture yourself as a young child standing before you, perhaps 4 or 5 years of age, if that allows tender feelings of kindness to flow more easily. And as you experience this love, notice how you feel in your body. Maybe you feel some warmth or heat in the face, a smile, a sense of expansiveness. This is loving kindness, a natural feeling that is accessible to all of us, always. Resting with this feeling of open, unconditional love for a few minutes. Letting yourself bask in the energy of loving kindness, breathing it in and breathing it out, inviting feelings of peace and acceptance. So, beginning now to wish yourself well by extending words of loving kindness to yourself. I'll be offering as guidance the phrases that I've chosen to use in my own practice. You're invited to alter these phrases and choose whatever words express your wishes of loving kindness toward yourself and others. Now meditate until you hear my voice again. May I be filled with loving kindness. May I be held in loving kindness. May I feel connected and calm. May I accept myself just as I am. May I be happy. May I know the natural joy of being alive. And now repeating in the mind these words of friendship and kindness to yourself once again. May I be filled with loving kindness. May I be held in loving kindness. May I feel connected and calm. May I accept myself just as I am. May I be happy. May I know the natural joy of being alive. Now you can open the circle of loving kindness by bringing to mind someone who is dear to you, someone whom you care about and who has always been supportive. Reflect on this person's basic goodness, sensing what it is in particular that you love about him or her. In your heart, feel your appreciation for this dear one and begin your simple offering. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. Now bring to mind a neutral person. This is someone you might see regularly, but don't know well. It might be a neighbour, a grocery store clerk. Bring this person to mind now and repeat the words of loving kindness. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. And now, if it's possible for you, bring to mind someone with whom you've had a difficult relationship. Perhaps it's someone you don't like to feel sympathy or compassion for, seeing if it's possible to let go of feelings of resentment and dislike for this person. Reminding yourself to see this person as a whole being, deserving of love and kindness, as someone who feels pain and anxiety, as someone who also suffers. Seeing if it's possible to extend to this person the words of loving kindness in your mind. Now meditate until you hear my voice again. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. Now allow your awareness to open out in all directions. Yourself a dear one, a neutral person and a difficult person, and of all beings, humans and animals living everywhere, living in richness, poverty, war, peace, hunger, abundance, aware of all the joys and sorrows that all beings experience. May all beings be filled with loving kindness. May all beings be happy. May all beings awaken and be free. May all beings be happy. And now bringing this practice to a close by coming back to extend kindness to yourself. Sitting for a while and basking in the energy of loving kindness that may have been generated here. Now meditate until you hear my voice again. End of meditation, part 1.